Hey guys, welcome to my channel. I'm sorry if you hear a few like rattling noises or like vibrating noises or whatever, but I have a almost 5-month-old and she's awake from her nap, and unfortunately it was kind of like this is the only time I can film. So she's in the lounge room, which is just right next to me, just in her little bouncer and watching the TV, which I muted so that I can film this video. So last year I uploaded a video giving you guys tips on how to become a administration officer or how to get into health administration, as obviously I am an administration officer. So I've been working in the health administration field for about 7 years. I did when my oldest girl, who is 8 now, when she was about 1 year old, I got into it. And my background before working in health administration was just like, I've worked in hospitality, I've worked in retail, I've worked in call centers. So yeah, I've just worked at I've worked a lot of customer service based. And when I did my resume up, and I applied for administration officer positions in a hospital, I just really focused on my customer service and how passionate I was providing customer service, and how empathetic of a person I am, and that I don't judge people, and I have no problems with communicating to people of all different kinds of backgrounds, because you might get a lot of non-English speaking people, which you need to be very patient with. So I just really emphasized, and obviously I just really emphasized that I was passionate about providing good customer service, and I really focused on admin. So admin can be like, you know, customer service, admin sort of things. And even if I had a role, say in hospitality, and I didn't do any admin, I would put general admin on my list of duties in my resume. And I applied for a few positions. Like, I just kept applying and applying, and eventually I got a position, and it was at the PA hospital in Brisbane, which is the Princess Alexandra Hospital, and it's one of like the biggest trauma hospital in Queensland, and for overseas, parts of overseas as well. Anyway, so yeah, I was a reliever in there. I started as casual. I wasn't on a contract, wasn't permanent. I started as a casual, and I was relieved around the hospital. So when all like the permanent staff in certain sections like the wards and the outpatient departments, when they were sick or on leave, then there'd be a pool of staff that would go and cover them. Anyway, so I gave you guys some tips on how to like get into administration health, because I would get asked this question like in my everyday life. Like, I would get it from people if I went to the service station, which is like gas station in America, service station. I would get it, I got asked how to get into it if it just came up in general conversation. I got like Facebook messages from friends I went to school with. I've just received a lot of questions in how to get into it, and it is a really good profession. And I just thought I would make a video, and it's done really well. And yeah, it's done really well for this small little YouTube platform I have. It's done really well, and I've gotten a lot of questions, whether that's comments on the actual video or private messages or whatever that may be. I've gotten a lot of different questions, and I thought I would make a bit of a video answering some of those questions, because if you have watched the previous video, it was like a sort of vlog and tips on how to get into health administration, then you might have a few more questions relating to it. So I thought I would give you a few answers to the questions. So I wrote some of them down. So the first question I'm going to answer is, how do hospital managers and hospital administration staff differ? Like, what's the difference between a manager and an admin, like the admin in the hospitals? So I'm just letting you guys know that I am, if you can't tell from my accent, I am Australian, but I also do live in Australia. So all my answers to the questions are obviously based on my knowledge of Australia. So it could be very different. It could be very different in another country that you live in, or slightly different depending on what state you live in. So I live in Queensland in Australia, and obviously I've never lived in other states before, so it could differ a little bit, but it's pretty much, I think it's pretty much the same. So, but in saying that, it could be very different depending on what country you are in. So administration staff deal with patients and liaise with doctors and nurses, and they're like the front, they're like the front of house role. So even if they're okay, even if sometimes it's okay, Papa. So even if they're in the back, you know, and they take it like in turns of answering phones or something, if it's in a big like outpatient department, and sometimes they rotate between the front, which is checking in patients and checking out patients, making appointments, all that sort of stuff, and then sometimes the admin out the back, they'll answer the phones, and they will go through referrals and all that sort of stuff. But basically, administration officers are the front of house. But managers, well, what do? They manage, right? So they manage the staff, they coordinate staff. Sorry, my baby's just getting a little bit fussy. One moment, sorry about that, but if I try and find the most perfect moment to film, it'll never happen, because with a baby there's never a perfect moment to film. Anyway, so yes, with managers, they manage, right? So so that means that their main focus, their main job, their main role, whatever you want to call it, is to manage their staff. And in the hospital, most hospitals I've worked at, when I've worked at a few different ones doing a few different things, there has been 2 managers. And currently at the hospital, I'm on maternity leave at the moment, and I go back in start of November, but there's always been 2 managers, hospital managers at the hospital that I work in, and one looks after the relief pool, which is what I'm doing now. So I'm not just in one ward anymore. I'm still permanent, I'm part-time permanent, but I am now in the relief pool. So that means that I can be going to the ward one day, I could be going to outpatients the next day, I could be going to children's, I could be covering like the children's ward all week if someone was away and they assigned me to that ward, or I could be doing different things, be in different areas like every day, Monday to Friday, because we don't work weekends unless it's after hours, which they've got rid of. That's why I'm no longer working in the after hours role like I was previously, like in the previous video if you've watched that, because digital hospital has come into play, and the only after hours staff in administration in my hospital and most of the hospitals now are the emergency staff, the emergency administration staff. So yeah, so the managers manage the staff, and well, they coordinate the staff. So their main role is to coordinate and just follow up on things with this administration staff, like just reports and stuff that they haven't done or whatever. Then they get like, they send us emails, they follow up on things like, you know, they might have like meetings with us if something has been reported from like a nurse, or like a nurse unit manager, or like a team leader, or another staff, like admin staff. You know, they'll be a manager, just like every manager in all workplaces. they manage their staff. So yeah, their main job is to coordinate their staff and make sure that they have adequate staff in the roles that need to be filled, if that makes sense. So they'll manage, like they'll coordinate their leave and all that sort of stuff. And then they have a few of their own little tasks to do, like just reports and stuff like that, but it's nothing complex. Another question I've received is, can I be this if I'm so shy? And of course you can. Even though it is a front face role, you're communicating and you're interacting with people front on, face-to-face interactions mostly. I mean, you still have interactions over the phone. You're interacting with a lot of different people, like nurses, doctors, any healthcare professional workers. Could be dietitians, it could be counselors, it could be social workers. You know, you're liaising with your team leader, which is a nurse unit manager, or like you're liaising with, you know, you're like team leader, and that's like a nurse in charge. You're also talking to patients face to face and on the phone and their family members, but I can tell you that I am an introverted personality type. I still struggle. There's areas that I have, I do well at, but there's other areas that I don't, and I struggle to speak to my superiors, like my managers and all that kind of thing, and that kind of goes back from, you know, me being a child and stuff. But I just yeah, I can speak to them, but I always have a little bit of difficulty like expressing myself. If I have an issue, I get really nervous and I just struggle a lot with that. So we all have our strengths and weaknesses, and I am naturally a shy person. I won't necessarily just talk to people, but then also before I had kids, I was even more shy than I am. Like, since having kids, I've been able to really come out more of my own little bubble. So I definitely think that you can absolutely be in this type of career and this position if you are shy. Absolutely. And if anything, it will actually help really bring a little bit more you know, of your strengths, and you'll find when you're talking to people that it'll just put a lot of things in perspective when you're talking to patients and family members and stuff. And you know, most of the time, if you struggle to talk or to interact, what you should do is get people to talk about themselves, because everyone likes to talk about themselves, and it's easier for you if you struggle to communicate, like if you're talking about someone, or like if you're talking to someone, or you have a co-worker next to you, like another administration officer, and you're able to have a little conversation. Just talk to them about themselves, like ask them questions. And also just keep in mind that there's always someone that can help you. There's nursing staff, you know, if you're just struggling, then there's always someone that can help you. There's other administration officers, there's nurses, there's your managers, all that kind of stuff. So you definitely have like a big support system, and they can help you, and all the training is on the job training. So I know it can be difficult and it can be a little bit scary, looking at getting outside your own bubble and thinking about what it would be like if you can do it, if you're shy, what it will be like to be able to be in a role that requires you to speak and communicate a lot. But you know, as much as that's a component of your job, your main job is data. So that's it, that's your main focus. Your main focus is data. And yes, even though you're getting that data, some of that data from patients, the communication isn't as big of a point as data. So yeah, that's your main focus. That's your main job, is data and entering data and all that kind of thing. So you know, and you get a lot of job satisfaction. And I also want to say too that when it comes to like patients and all that kind of thing, you don't really need to communicate a lot with them. And any communication, like, you don't need to start a communication with them, if that makes sense. So they'll come up to you and keep trying to communicate, or like come up to you and communicate to you, whether that's asking you a question or whatever, like, and then you can go and find like people to help answer that question or whatever that may be. But I hope I'm coming across to you. I hope I'm making sense to you, but I just want to let you know that yes, you can definitely do this if you're a shy person, because we know we all have strengths and weaknesses, and we're not all built for the same thing. But there's so many aspects of this job too, and I definitely have moments where I'm reserved and I'm shy, you know, so, but like I said, it can bring out so many good things in you as well. So just don't let that discourage you at all, and honestly, just give it a go. Apply for the positions, look up, search for the casual positions, because that's where you will get hired into. Don't bother about trying to apply for permanent positions straight off the bat until you actually get into health, and then you apply for a permanent position once you have that a little bit more experience. So yeah, so good luck, and let me know if you have any more questions, or I can help you in any other way. But next question is next question is, I heard that after college you need 4 years of hospital experience to become a hospital manager. What tips could I get? Okay, so I've actually never been a hospital manager. Like, I've never been a manager before. I've always just been an entry-level administration officer. I haven't applied for any manager positions, but in Australia you don't actually need any qualifications to get into health administration, and you actually don't need any qualifications to be a manager in health as well. So all the different managers I have had over the years, in the last 7 years I've worked in this industry, all the managers that I have come across have been people who have started as just administration officers in health, and they've just applied for a manager position and they've gotten it, and they might just have worked there for 2 years or 3 years or something like that, right? And they've just been really good staff members. Like, if they were in the relief pool, they would, you know, every time they got called for a shift or an extra shift or something like that, they would like accept it, or they would just be very reliable and all that kind of thing. So, and they would be like good at their job. But yeah, there's been so many different types of people that have applied for manager positions and gotten them, and some of them have not been the best managers, because yeah, you know, it does take a kind of good it takes skills to be a good leader, a good manager. But you don't need, in Australia, you do not need any qualifications to be a manager. Just, if you want to be a manager, just apply for a health administration officer jobs, get in, which by the way is paid very well. Like, it's a really good paying position, and then apply for the manager positions after you've been there for a year or two or whatever, you know, when they come up and they're available. So that's my tip. Next question is, have you done a course related to this field, like a certificate or a diploma? Which one would you recommend? I have not done any certificates or diplomas to get into health administration. Like I said, I started 7 years ago, and I just applied for casual positions, casual relief pool, because they need quite a big pool of staff, relief staff, to fill the positions when the permanent staff have sick days, when they go on annual leave, which is like rec days, when they go on their additional day off, like RDOs, a rostered day off. And the managers need to coordinate staff to fill those positions. And then sometimes the relief staff will go on, like they'll be on contracts, and they'll relieve staff, permanent staff that are on secondments. So say for example, there's an administration officer, she is permanent in a ward and she owns that position, and then she applies for another position as a contract, and she gets the position. So she still owns the previous, she still owns her position. So her substantive position, I think it's called. So then she's on a secondment. So she might be on a secondment for like, 3 weeks or a month or 6 months. And then when that secondment finishes, she might go back to her position. But then sometimes the managers need the relief staff to fill that position in the ward. So, some of the relief pool staff will be in a contract for weeks or months as well. So they need a lot of relief staff. And also, I don't know if this is different in other countries, but it is in Australia that the government gets, like the state government gets a budget every year for health, right? So because we have private hospitals and we have public hospitals and we have free healthcare. So the state government gets a budget, and they get a budget. Part of their budget is staffing. So for example, like they'll have a budget for administration staff. Sorry about that. So they have a budget, and if they don't hire their staff, they don't use that budget, that whole budget allocated just for staff, like administration staff, if they don't use all that budget, then they don't get the same funding for the year after. So that's why, if you've looked for Queensland, they have smart jobs, and that's where it's smartjobs.qld.gov.au. And that's why, for example, they will advertise every single financial year, either the beginning or the end of every financial year, they will advertise for staff, relief staff. So that is why you have a good opportunity to be able to get into it. And if you just get in, once you're in, you will find it so much easier to be able to apply for other positions. And if once you're in and you've just had a little bit of experience, then you'll find it so much easier to apply for other positions. So just keep that in mind. So yeah, so I hope that I have answered all the questions as best as I can. If you have any questions, any more questions, then please leave them down below. I would love to answer them for you. I also did get a question about what do you actually do as an administration officer in health, right? So what's your role? And that, I thought, is a really good question, and I'm gonna make a whole different video on that. The role is very vast, but there's a lot of different aspects to the role. There's a lot of puzzle pieces, and we all hold a very crucial role and part of the puzzle piece that fits all together to make health work and to make the hospital and community run smoothly. I mean, it's not perfect, we're humans, but we are, as administration officers, we are very important to the working and the running of this business, which it is a business. The hospital is still a business. Health is still a business, okay? So, and that's actually why health administration officers get paid so well, because we're actually making money for the hospital. We're making money for health, Queensland Health, right? So, because we do, our main focus, our main job is data and putting in data and making money. So yeah, that's why we actually get paid more than nurses. And one thing that I really love about this job as a whole is that I feel like you don't have to become a nurse or a doctor to be able to make a difference and to really help people. And I get so much satisfaction when I'm at work. Sometimes I have a really shit crappy time, other times I just feel like, oh, like I feel really just good about leaving at the end of the day to go home, and I feel like I've helped something. I've been a part of something, and I've contributed to something good, you know. As I like to help people, and that's what I like to do. And yeah, it's a really good position, and like I said, it pays really, really good for, especially for a position that you do not have to go to unis, that you don't study for. You don't need to do any courses or any bachelor degrees or anything like that. So it's amazing, and I fully suggest that you guys apply for these positions and just don't give up. Apply, apply, and apply. But yeah, if you're interested in this kind of content, then I'd love for you to subscribe and hit the bell. I am a mom. I make lifestyle videos, but I also am a working mom, and I work in health, and I love what I do. So yeah, and I'm happy to help you guys try and get into it as best as I can. If you have any suggestions on any videos that you would like me to make, then please let me know in the comments down below, or message me privately on Instagram, whatever you feel comfortable in doing. And yeah, I return back to work in November, which isn't that far away. My baby is, she's gonna be 5 months next week at the time of making this video. So yeah, so that's not too far away. So it'll be really interesting to see. Obviously, I haven't been to work since January. I haven't been at work since January, so it'll be very interesting, to say the least, about what I'm walking back into and how different the dynamic is going to be. But I will vlog. I'll do some work vlogs when I get back to work, and yeah, just keep you guys, let you know what it's like being an administration officer in health. And just, yeah, if you want to follow along the journey, like I said, I'd love for you to subscribe. And yeah, until next time, in my next upload, thanks for watching, and I'll talk to you guys later. Thanks guys, bye.